Hello friends, let us now learn some important points about lactose intolerance in children. So if you see the lactose intolerance in children, we can divide the lactose intolerance into two types. One, we have congenital or primary lactose intolerance, or we have secondary lactose intolerance or acquired lactose intolerance. Primary lactose intolerance or congenital lactose intolerance occurs due to the mutation of the gene lactase, which is present on chromosome 2. Whereas this secondary lactose intolerance is most common and it occurs due to some infections. Then if you see the clinical features, here the baby presents with diarrhea, abdominal pain will be there, and there is vomiting also. Especially all these occurs after the baby takes milk products. So there will be perianal excoriation will be seen because of acidic stools. So how are you going to diagnose it? The diagnosis is done by seeing reducing substances in the stool. In the stool you will see reducing substances are seen positive in the stool, are present in the stool, and you will also see lactase breath test. Reducing substance is present in the stool and lactose breath test is also seen. This is confirmed by exclusion of milk. And if you do a small intestinal biopsy, this small intestinal biopsy will decrease the lactase activity, will show decreased lactase activity. Actually this is one of the good tests for lactose intolerance. Then how are you going to treat this lactose intolerance? Lactose intolerance is treated by asking the patient to avoid milk, or skimmed milk should not be given, or any milk product should not be given. But in lactose intolerance we can give curd or yogurt, but you should not give milk. Thank you guys for watching.